You've already heard 100 times about the common holiday hazards, and we even did an episode on them 2 years ago. But what you might not know is that even if you've prepped your house for the holidays, the real dangers can show up with your guests. Today, veterinarian Dr. Zhu from Family Animal Hospital and I will take a tour through your family and break down the sneaky, unexpected things they might bring into your home, plus the toxicity signs you need to catch early, and a special resource that could save your pet's life. So stay tuned. You've reached the Pet Parent Hotline, your lifeline to practical solutions for your toughest pet parenting challenges. I'm your host, Amy Castro, and I'm here to help you cut through the noise and turn expert advice into step-by-step strategies so you can stop chasing your tail and start enjoying life with pets again. A couple of years ago, we covered all the usual holiday hazards in pretty great detail with an ER vet. By now, you know the basics, right? Chocolate, grapes, tinsel, tree water, all the standard stuff that can hurt your pet. But today, we're going to turn the spotlight to things that people might not think about. So this is Holiday Hazards 2.0, the sneaky, surprising risks that your guests bring right through your front door. From your cousin Mike's special treats to grandma's traveling pharmacy of a purse, to Aunt Judy's vintage decorations, and more. There are hazards that don't even look like hazards. Most importantly, we're going to talk about what toxicity actually looks like in pets, so you'll know when something's off and when it's time to act. Dr. Zhu, welcome back to the show.
Hi, thank you for having me on. I appreciate it.
And happy holidays.
Thank you. Happy holidays.
And hopefully not hazardous holidays.
Hopefully not.
For our pet friends.
Let's help people stay out of trouble.
Let's definitely do that.
Okay.
So, first of all, tell us where we are. You've got this lovely background.
This is a lovely background on my anesthetic monitor here, but we're actually in our surgery suite. And what I'm hoping is none of the patients during the holidays have a reason to be here, especially foreign bodies and other things like that. So I think we've got a good list of things to talk about to avoid trouble.
Yes, let's stay out of trouble. As much as I love you, I don't want to see you on Christmas morning.
Christmas.
Yeah.
Same feeling.
For sure. All right. So we're going to do this a little bit different than we've done episodes in the past where we just kind of list off like, here's what it is, here's why it's dangerous. We're going to have a little fun with it because I'm going to go with the assumption that you've already seen or heard our episode about holiday hazards, and we'll put a link to that episode. And we talked about the common ones like chocolate, like tinsel for your cats, and we listed a whole bunch of other things. So this is the 2.0 holiday hazard version.
So there's always something new out there.
It's going to be the test. It's going to be the test. And what we're going to do is we're going to assume you've done a great job of pet proofing and making your house nice and safe for your pets over the holidays. Mm-hmm. But the one thing that you can't necessarily control are those pesky holiday guests.
And have holidays without the guests.
Well, you could try.
Yeah, it wouldn't be the same. But yeah.
Well, then you might be forced to have them. So we're just going to tour through the family and talk about some of the things that they might bring. And I'm sure these are not your relatives.
Oh, no.
But these are...
All of mine run away from family feuds. We're good.
There you go. All right. So let's start off and talk about everybody's got that cousin. We're just going to call him Mellow Mike. You know the guy.
Yes.
Always has a little something extra to make the holidays especially merry.
Yeah.
And what would be some of the things that he might bring that could be dangerous to our pets?
There's such a variety of things that Mellow Mike could bring, from the traditional smokable herbs.
Yes.
Marijuana is the one we're talking about. But now, as y'all know, there's so many varieties of these things, from chewies and gums and treats and chocolates and brownies. And pets like those sweet versions just like we do.
Mm-hmm.
Okay, maybe not the part with the herbs, but at least the sweet part of it. And so they're exposed. They're going to be tempted to take a bite of that brownie, or if you drop a little something, on the ground, they might scoop it up before you do. So THC and marijuana are often products in those special treats during the holidays that Mike might bring.
Yeah, so you need to have the equivalent of a TSA screening booth at your front door And make sure you watch Mike, check his
Yeah.
eyes and see
Yeah.
what before he offers you
I
that
take a
brownie.
shot.
Yeah.
Yes.
And is he winking when he's saying, "Hey, these are my special recipe," or
Yes.
something like
Yes,
that? Because
exactly.
it could get your pets into big
Into
trouble.
trouble.
And what would be some signs if our pets, like maybe he didn't tell us he
Yeah.
brought one of these things?
Yeah.
He's got them in his suitcase and the dog knows he's in, which always
Yes.
keep the bedroom doors
Yes, keep
closed.
them closed, keep things up on shelves. Yeah, I think the first signs are real subtle. Their pet may be more quiet, a little more sleepy. You're kind of going, "Where is Fluffy? What's he up to?" When you find that pet, sometimes you start to try to get him to get up, go for a potty break, and you'll notice they have a little wobbly walk or sway when they're walking.
So basically, they're acting stoned.
They're acting drunk and stoned. Yes, exactly. And so that's sort of the first steps. They have often some kind of like a hyper reaction, maybe the paranoia that we talk about to certain noises. And so, like if you clapped your hands suddenly, sometimes they do like a weird twitch, but then they just immediately melt into that sleepy phase and posture and mentation again. So if you see that, obviously they're not reacting or responding to you like they normally would. If you said, "Hey, let's go potty or let's have a treat," that might be a sign that they got into a toxin.
Yeah.
So, yeah.
And I apologize for laughing about it because it is kind of funny the way that we're talking about it, but it's not going to be funny especially if your pet gets into
Yeah.
a lot of that.
Yes, the higher doses can be even deadlier doses. We've seen hypoglycemia, we've seen coma type of behaviors. And the size of your pet matters. A little Yorkie versus a German Shepherd. Obviously, their dose in this case is dose dependent for the kind of toxin response that we see in those cases.
Yeah.
So we do want to, if we find such a thing out, we do want to try to get to it as quickly as possible because sometimes you'll see it before the signs. And that's really going to be sort of a theme through a lot of these toxins is the sooner you find the problem, the quicker you can evacuate their stomach. That means force them to vomit. A lot of times that can prevent the actual symptoms and the side effects of it being truly absorbed. So if we can get it out of their stomach before it's absorbed or the majority is absorbed, the better. We can avoid some of the life-threatening signs.
Yeah, that's and better safe than sorry.
Yeah,
I know one Thanksgiving was sort of ruined for us from we thought that the dogs had gotten into rat poison of all
scary.
things. That's a whole other story.
Yeah.
But it's like, you don't want to sit around and wait and see what happens with something like that.
Yep,
so
right.
It can be very dicey. What about the cousin that's quitting smoking, the nicotine patches, or even vape? It's not vaping is
Well, anything with nicotine is a stimulant and can make the heart race. And those animals, they might look more like they're trembling and hyper. Maybe they're salivating sometimes. If you notice that they're a little more agitated, like if another animal comes up or another dog or cat that they're normally fine with and they're kind of agitated toward that animal, you might actually could put your hand on their chest and you might feel their heart racing. It feels like a kick drum in there. If you feel that, if you see that your animal is tense or shaking, drooling, I would say, again, get to the EC as quick as possible, and so that you can have their stomach evacuated. They will probably, if you're already seeing those symptoms, those animals usually get hospitalized with calming medications, anything from just IV fluids to hurry up and flush out the toxin out of their system to sedatives of different kinds and arrays, depending on how they respond to those, or even muscle relaxants, because some of those animals will actually tremor into almost like a seizure type of behavior.
Oh, wow.
And they can overheat, that sort of thing. So you'll see that. Another common theme that we're going to be sharing throughout this is there is the ASPCA poison control hotline, and they have basically toxin experts that will help you and the veterinarian figure out, how much is the dose that my pet could have gotten into, the max and the minimum. What are the antitoxic medicines we could use? And then basically calculate those things based on your pet's weight. It's very specific, and they have some of the newest studies that are out there. There are a lot of tools because there's so many kinds of toxins.
Yeah, that's the thing. It's like, how do you stay on top of all of that?
We've had to come out with so many new tools for that, and the ASPCA organizes all that. So it's really nice that their 1-800 pet poison hotline number is available to all. There is a fee. It's very much worth the fee. I think it's in less than $100 last I checked.
Cheaper than the emergency vet.
Yes, yes.
Let's get you started.
And they might get you started, and they might actually help guide you that, hey, this is going to be something you can not have to go to the vet for. But many times, if it is, you want them and we want them in our pockets too. In fact, if you haven't called by the time you get to a facility, likely that we'll be the ones calling on your behalf. And of course, there is definitely charges related to that. But again, worth every penny because it could save your pet's life.
Yeah.
Yeah, for sure.
Good. All right. So we picked on our cousin enough.
Sorry.
What about grandma? So grandma may come with a purse load or a suitcase full of her medications.
Yeah, just as we all get older, we need more meds to keep us going.
That's right. And the one thing I would say, and you can correct me if I'm wrong, but it could be such a wide array of things. It's not like you could say, here's the exact signs to know that they got into your grandma's medication.
True.
But let's say we discover the pill bottle, and I can guarantee you your grandma very unlikely has any idea how many pills are left in that bottle.
Oh, yeah, no.
That's the one that's always dicey. Because I couldn't even tell you what's in my medication bottle right now. I could give you a ballpark, but...
Yeah. Well, when I shake it, it sounds like a week. That's not very accurate. So, yeah. So that's the neat thing. The pet hotline, the poison control hotline will actually say, okay, well, what's the max number on the bottle? And then they'll give you some ranges so you can kind of match your symptoms with what you're seeing and what their exposure is. So they have their sort of ways to do like a worst case scenario treatment plan and the best case scenario treatment plan. But yeah, grandma wouldn't know. I mean, she's just lucky to get there on time, and enjoy the festivities.
There you go.
Without sharing her pills.
Yeah. So definitely, I don't know that you have to frisk grandma at the door, but maybe, help her put her stuff away. Make sure that her purse or wherever she keeps her medication, just ask her and put that up on a high dresser or something, and then hope that your cats don't collude into knocking that off. But that's why we shut the bedroom doors.
Yeah.
Keep those animals out of the bedroom.
Dog.
Yeah, there you go. So we did talk about the sugar-free gums and mints and things like that. We talked about that in the previous episode, but there's just going to be a lot of possibilities, whether it's stuff that Santa brings and puts in stockings or stuff that grandma has in her purse.
Yeah, anything out of the ordinary is what you want to look for, obviously. If their behavior changing, if they're hiding, if they're a little bit more anxious, if there's vomiting. Sometimes what's in the bottles isn't the problem, it's the bottle itself. They ate this much of the bottle, and the plastic can act like a foreign body itself. So again, that's where the vomiting or the appetite loss might come into play. So if you do find, let's say maybe you're worried about the medication, but you see that the bottle is destroyed, try to put the pieces back and see how much bottle is possibly swallowed versus it just got destroyed. So that really does help decide, is this piece small enough that this pet is going to pass it the natural way, or is it going to be big enough that it could cause a blockage? So not only do we want you to kind of get a list of what might have been medicines or gums or chews or things like that in grandma's purse, but we also want you to look at the bottles and the contents and what could possibly get stuck in the intestines as well.
I didn't even think about that.
So it's more than one problem.
Well, and when you're looking, you all know your pet's behavior. Like my dogs are very likely to grab and run because they know if I catch them with whatever it is in their mouth, so they're going to go and hide it somewhere. So where are their hiding places? Because that's where you may find that missing cap or that part of the bottle, and you don't have to panic. So look around. Under the couch.
Yeah, it's always under the couch. Yeah, something like that.
That's right. All right. So we're going to be careful about grandma. So everybody probably has an Aunt Helen, kind of the one that is the family. We can call her the historian if we want to be nice, or we can call her the family hoarder.
The hoarder.
Yeah. So let's say that Aunt Helen has decided that she wants to bring along with her, maybe she's going to give this to you as your inheritance.
Oh my.
Some old family heirloom type things. Okay. And one of the things that I was reading about, which I was kind of shocked, did you ever really think about what's inside a snow globe?
It just looks like a festive little toy, but you're saying there's a danger in there.
Yeah, it may not be just water inside that snow globe.
Okay. I've heard ethylene glycol is one of those.
Yeah, that's what I'm going. That's where I'm going.
Ethylene glycol is a toxin that basically, when they first ingest it, is okay, and then it gets digested in the liver, and it becomes poisonous to both the liver and the kidneys. And it works fast, and it works awfully in animals, in the sense that when you're having both liver and kidney failure, you're in big trouble. Causes this crystallization in the kidneys, and that's how it shuts the kidneys down. Mm-hmm. So treatment is important to get to it quickly. There are some neat remedies for that these days in our veterinary hospitals, but it really has to be caught within 24 hours. I think anything longer than that, and it's going to be a slim chance of surviving it. So we do want to try to get to that pet quickly.
And before you go any further,
Yeah.
though, ethylene glycol is basically the same thing that's an antifreeze.
That's right. It is the same thing in antifreeze.
So the same level of caution, if you happen to break a snow globe.
Yeah.
I mean, I don't think an animal's going to grab one and run off with it, but if one breaks, you're going to make sure you're going to clean that up.
The tricky part is for sure the antifreeze that you buy for your vehicles, it has a sweet taste to it.
Mm-hmm.
I'm not sure about what the flavor of the globe is, but a lot of times if you're paying attention to something, your animal wants to get to it, that even if it doesn't taste good, so definitely clean it up quickly. And then whatever tools you're using to clean that up, whether it's, rags or paper towels or whatever it might be, double bag and put it outside into the big trash bin, because dogs also like to get into the trash can. So might as well be extra cautious.
Yeah. That's a very good point, because you have the glass too.
Yes.
You're worried about them stepping in. So make sure you get that cleaned up. Another thing that has become sort of popular over the last maybe 2 years is, because people do like vintage stuff. Some people do, is the bubble lights.
Yeah.
And, I don't know I guess it's not really a matter of, you're never going to really know what's inside. So you just go with the assumption.
That's right.
That there's a chemical in
because it may or may not be, but be on the safe side. So so one of the ones that we were researching is this methylene chloride, and it can not only be a harsh chemical on the GI tract and basically cause like chemical burns on the inside, but it can absorb into the bloodstream and actually keep you from absorbing oxygen into your bloodstream.
That's right.
That we want to make sure anything that is an unusual chemical that allows something to be vintage, that means that this thing is still functioning. That many years, it's probably going to bring some pretty interesting chemicals to make 1950s glassware still do this crazy little bubble light thing. So I would say be on the safe side, get that out of your home as quickly as possible, especially if it does break or fracture.
And those things would be a lot easier for an animal to grab. You're got those lights laying on the floor for them to grab and run off with and break it open.
They just think you're playing with a toy as far as they're concerned. So their curiosity can be really troublesome.
All right. So then there's your brother-in-law, Techie Tom. And I know I said what we weren't going to repeat, and this is 2.0, but I feel like the issue of batteries. Everything's got batteries in it in some form or fashion. And
there's so many types of batteries, and many of them have hazards of their own. From the chemicals within them, again, being a chemical burn source, to them being a foreign body, to some of the metals in there basically causing a blood poisoning that can cause anemias and life-threatening situations. And you can't always tell it right away. Some of the chemicals you can, but the metals, it can take time for those metals to cause trouble over, weeks, months even. So if there is any chance that they've gotten into them, you want to know right away. The good thing is most of them show up on x-ray.
I was going to say.
Really well. Just bright on an x-ray. Not all foreign items show up that well, but those are pretty telltale. So at least give yourself peace of mind, get an x-ray, and know that there's not that metallic foreign body, which can later on cause a blood poisoning.
Yeah. And you'd think that your animals would be like, what would be attractive about that? But I've literally caught my dog chewing on a D battery. And it's like, where did you get that? It came out of a flashlight that fell on the floor and didn't get put back together. And it's like, why are you chewing on that?
I mean, I think anything that you've shown interest in, your pets will show interest in. I learned that the hard way. I'm a gardener. I love to garden, and I'll be, working, planting a brand new, fancy, expensive plant I decided to buy and put in. And I come inside for a little water break. I come back outside, and the German Shepherd has it in his mouth and is running around the yard. It's a toy now because I paid attention to it. There are plenty of bushes in my yard that they completely ignored, but just because we're interested, they want to be part of that excitement, and that's what gets them into trouble.
Yeah. And I think some of them are just kind of indiscriminate. Like I noticed the other day, I had been giving my dog some medication, and she's so quick to grab something and swallow it that I thought, I'm not going to put this in a pill pocket. I'm just going to toss it in the air.
Did it work?
Yeah, it worked.
Oh, right.
And then you have other ones, we see the videos of, you hand the golden retriever the cheese, and they're like, that is some suspicious looking cheese.
No.
So some of them are smarter than others.
Yes, maybe so.
Let's just say.
Their greed gets them sometimes.
Yeah. All right. So last but not least, we're going to go to the kitchen. And we've talked about, like I said, we've talked about chocolate and other things that can get pets in trouble. But something I was reading about recently was mom's in the kitchen working with the kids, doing crafts or
Yep.
baking or whatever
Yep.
the case may be.
Yep.
So salt dough, which
Yep.
I guess is just kind of like
A,
homemade
a
Play-Doh,
homemade
but it's
Play-Doh.
loaded with salt.
Yes, yes. And so salt itself, I mean, I'm a salt fiend. I'm the one shaking it all over the food, but at the higher concentrations, it can be really dangerous to the brain. It basically causes a swelling in the brain. As we know, water follows salt. So if you ingest too much salt and then you drink water on top of that, it follows the salt and causes the tissues of the brain to swell. And there's not a lot of room in the skull. So unfortunately, we'll start seeing neurologic signs in those pets that, again, the sort of like an ataxic walk. We might see that. We might see some nausea and vomiting just from the salt creating almost like a acid reflux. But that's the minimum of the problems. The brain problems are the scary ones. And so they have to be flushed out from salt in just the safe way. If you flush it out too quickly, actually adding water, and then that follows the salt and can worsen. So it's definitely something you and your veterinarian want to get to. Now, just like before, the theme that we're talking about is there are times and windows where you can help a pet vomit that sort of thing out before they absorb as much salt. So, of course, if it's stuck in the dough and you vomit a whole pile of dough, well, then hopefully you reduce the amount of salt that they're going to absorb.
Yeah.
Hopefully reduce or prevent some of those symptoms of salt toxicity. So if they get into that Play-Doh, get them, or the homemade Play-Doh or any salt, let's say you spilled the salt shaker, or let's say they got the salt shaker off the table. Even, for example, going to the beach, and, sometimes people do travel for holidays, and if you drink too much ocean water or salt water, you get the same effect.
Yeah, I had a friend that had a saltwater pool, and the dog just was he would drink out of the pool and then he would throw up.
Yeah.
And it was just like a thing.
Yeah.
Like, I don't know that that's the best thing.
It's not the best. At least you threw it up. But
Yeah.
for sure. I mean, at some point you could risk that they would absorb too much salt and show these neurologic signs, which again is like a drunken walk. Sometimes they actually look like they have a headache. They're kind of squinty eyed looking at you like they're in pain. And it easily shows up on blood testing if they have too much salt in their bloodstream.
Okay.
Yeah, it's a common test we do.
And then the other one thing I was thinking about along the same kind of lines of baking is yeast.
Yeah,
or yeast dough, like they get a hold of the dough.
Yeah, if they get the whole entire container of that, let's say you have the bread resting, I think is what they call it. I'm not a bread maker. I'm a bread eater, but I'm not a bread maker. Any of those things that can create more bubbles, because that's kind of, you can actually see what the yeast is doing to the bread itself. That can be happening on the inside. And gas can be painful, or even some animals are actually allergic to yeast and have vomiting or diarrhea. So another reason I would say to go ahead and have that pet vomit so you won't have to deal with the side effects of it. Mild things that can cause gas, you can actually treat with something like Gas X over the counter. Is very safe. But
like maybe they just get your German Shepherd gets a yeast roll
worth,
a little ball of dough versus I ate a whole loaf of bread's worth.
Exactly. So dose dependent.
Yeah,
I think that's a good way to look at it for sure. So so if you gave a Gas X for a small amount like that, you're probably good. But if your Yorkie decides to eat a whole loaf of yeast that's been resting in a container, you may want to go ahead and see the veterinarian to prevent trouble. That's kind of the same thing with chocolate. That I know we've covered that, but sometimes it's not the chocolate; it's all the butter and the sugar that's in there. And even though maybe the amount of chocolate isn't toxic, we may make a pet vomit to avoid the butter and sugar going through the intestines and changing up some of that bacteria that then causes diarrhea and vomiting, pancreatitis even. So sometimes it's worth it to vomit, to cause that pet to vomit and prevent the long-term issue of that toxin making its way throughout the GI tract.
Okay.
Yeah. So one of our treatments that we do use is activated charcoal. It does seem to block certain toxins. The pet poison control, again, they're very helpful with that, deciding which ones charcoal is good for. But it is very safe, and it can block the absorption of lots of medicines and drugs, and timing does matter in that as well.
Okay. Yeah. Now, when you're talking about, making them vomit, I had a Doberman Pinscher that ate lots of things. So we kept an industrial sized bottle of hydrogen peroxide underneath. Like, is it safe to say, oh, I know my dog ate that, too much of that dough. I don't want it, even if it's not a deadly dose or not a deadly dose, but if it's not a dangerous dose, but I just don't want to deal with the aftermath of all of that. Or is it better to just leave that to the professionals?
There's no matter what treatments of any kind you do, even when your veterinary professional is doing it, there's always risk associated. if we induce vomiting using an injectable medicine, or sometimes we have special drops you could put in the eye that induce vomiting, it's never zero risk. For example, they could maybe accidentally inhale or aspirate some of that vomit. So we have to decide, is that risk smaller than the risk of them ingesting this poison and what it could do for them?
Mm.
And those are pretty rare things that happen as far as like aspirating with vomiting. So the same risk can happen at home. In a certain scenario, like I'm going to be more than 2 hours away from my regular vet or a veterinarian, I may need to go ahead and induce vomiting. When I call pet poison control, they might say, yeah, grab that hydrogen peroxide. I want
That's
you to
right.
do that because by the time you get to your vet, they're already going to absorb a toxic dose. So let's do this now together. The risk is less,
Yeah.
and they'll probably say, these are the risks over the phone, just like, all the legal talk we have to do.
Sure.
But I would say in a certain scenario like that, I would definitely have hydrogen peroxide close by. Another thing is there are certain breeds that are more risky to aspirate, and that's your brachiocephalic. So like your bulldogs and your Frenchies, they have sort of already a deformed shaped airway. And so they're more likely to have aspiration. So that would be one that I would, if it's within a safe time limit, I would try to get to your regular veterinarian. While a Dobie or a Shepherd or somebody with a longer nose, they handle vomiting better and more naturally than some of the dogs that are not built that way.
Yeah.
So yeah, hydrogen peroxide can be helpful. And at the very least, if you can't get your vet to do that, I do think your poison control hotline can help.
Yeah, that's I forgot about that. You can always get that advice first before you take any action.
Time is of the essence a lot of times, and that will be a great way to take advantage of that knowledge they have.
For all these holiday hazards, is there a rule of thumb so that we don't miss an early sign?
Yeah. I think the rule of thumb is between 1 and 2 hours as far as ingesting a toxin or a medication. The things like an aspirin or an ibuprofen or something like that, those drugs tend to not have coatings on them. They absorb pretty fast, so I'd say within an hour or so. Things that are a little more goopy, things like we talked about the dough or something that has a good coating on it, or plastics or things like that, you have closer to the 2 hour mark.
Yeah.
So that's, as far as a rule of thumb, that's a time limit thing that would be between 1 and 2 hours.
Okay.
As far as activated charcoal or administering those other things, those happen, usually in an interval of like every 6 hours or so. Certain, we talked about kidney stuff related to the ethylene glycol. You want to get that figured out within 24 hours, because the longer that ethylene glycol is in there turning into these crystals that shut down the kidneys, of course, the worse it is for long-term survivability of the kidneys and the pet.
Are there some universal, like, not a universal sign? Like, my first thought would be a universal sign that something is going on is just your pet not acting like themselves.
Yeah.
Eliminating maybe just the fact that it's the holiday and it's a little bit weird and maybe they're a little excited.
Yes.
Beyond that.
I think being too hidden away or being too anxious, those are kind of the mental states that you're looking for. Why is he under the bed? That should definitely catch your attention. Or, why is he jittery and jumpy with every noise, sound, or person that walks by? And that can be hard to gauge, but what I always tell my clients is that your pet better than anyone. You've lived their whole life with you.
Yeah.
And so if you think there's anything out of the ordinary for how they would respond or react, I think it's always worth it to be on the cautious side.
Yeah.
So if they're normally would respond friendly to a family member that's come over, but instead now they're hiding, that should catch your attention. And certainly some of it can be shyness or anxiety, but then maybe go do a normal activity. Like, okay, well, even though he's anxious with my family member, maybe if we go out for a walk like we normally do, and he handles that normally, then it's just the family member. But if we go out for a walk and he's drunk and walking and he doesn't know his usual stops where he marks urine and whatever, people that he sees or other dogs that he would normally bark at, he's not responding to that, that should catch your attention.
Yeah. I think too, if people, if you think about it from the standpoint of, if you're asking the question, is there something wrong? You probably might already know.
Listen to your
listen to your gut.
Exactly. Oh, so many times I wish I'd listened to my gut.
I know. I know. So, any final thoughts, tips, or whatever for keeping our pets safe for the holidays?
Yeah, I think really, an ounce of prevention is worth, all your trouble for sure.
So you're saying frisk grandma.
First, grandma, pretend you're hugging her, and then do a little slide down. But yeah,
You distract her and your husband can be rifling through
there
her
you
purse.
go. Or it could
Or
be more
whoever.
like, let me help you take a load off and put grandma's purse up. But yeah, I think people are understanding when you explain ahead of time what you're doing, what you're trying to prevent. I think people, especially if they're going to be a guest in your home, hopefully they'll understand the precautions, especially if they're not a pet person and they don't understand how pets behave, let's say.
Yeah.
So, yeah, I think a little bit of education and prevention is the best way to handle that sort of thing.
Yeah. And you can always blame it on yourself. Like, don't blame it on, I don't trust you, but my dog's not well behaved. And so therefore I, got to protect him from himself.
There you go. I'm gonna be so busy, I won't be able to keep an eye on things. So let me help you.
Yeah.
And I do think sometimes it's stuff that people want to be interacting with your pet, but they don't realize what's dangerous or what's not. Maybe
Yeah.
she puts her purse down to give your pet a hug or snuggle, and then that's when the pet takes their opportunity to swipe a bottle and run off.
I was not paying attention.
There's
Just a-
and little,
Yeah.
don't take advantage.
Right. Awesome. Well, Dr. Zoo, thank you once again for being on the show.
Thanks you
and
guys for having us.
appreciate your wisdom and advice here. Hopefully we
Yeah.
can all stay nice and safe
Enjoy
during the
our
holidays.
Christmas holiday.
Enjoy a scene just like this.
So
Peace
peaceful.
and harmony, a little snow.
Yeah.
And we'll see
Okay.
you next week.
We'll see you next week.
If there's one big takeaway from today, it's this. You know your pet better than anyone else. So if something feels off, trust that instinct. Hiding, wobbling, jittery behavior, vomiting, that glassy-eyed look, those are all signs to pay attention to, especially during the holidays when new hazards walk in the door disguised as relatives, gifts, and traditions. Be sure to act early, grab whatever they may have gotten into, and call your vet or the nearest emergency clinic. A quick response can make the difference. And if you want this episode handy when the holiday chaos starts, make sure you tap right now to follow. That way, when Cousin Mike and the rest of the family roll on in, you can pull this episode up instantly and know exactly what signs to watch for. And we'd love to hear from you. If you've run into a weird holiday hazard before or have a question you want answered on future episodes, head on over to petparenthotline.com and send me a message. Your real-life stories and questions are what shaped this show. Thanks for listening to the Pet Parent Hotline. If you enjoyed the show, don't keep it to yourself. Text a friend right now with a link and tell them I've got a show that you need to hear. And ask them to let you know what they think. And remember, your pet's best life starts with you living yours. So be sure to take good care of yourself this week and your pets.